Very much, Barbara. And indeed, I hope to say some things that'll be helpful and meaningful to every single one of you. And I do hope you can give and reach out. This is a time in our country and around the world when we need kindness and we need reaching out and helping others. I know I've already made my contribution. Now, one of the things I truly enjoy about working at NSU, Florida, is our dedication to community service and sharing expertise in our clinics and on behalf of all of our professors all around the university. Now, our subject today is a really serious one. And somehow, I'm pretty sure I'm not the only one who lost a loved one to suicide. You know, the research says that when we have someone die by suicide, it profoundly affects 18 of us, and it affects up to 135 people somewhat. Well, when I was 25, I lost my father to suicide. And if you lost a loved one to suicide, I have some idea of what you've gone through. But the vast majority of suicides can be prevented. And we really need to make suicide prevention a priority in our country. And as you glance at these slides, the most recent figures are 2 years old. 48,000 Americans died by suicide in 2018. Most people would say that's an underestimate because there are a lot of suicides that are classified as an accident. But that is the highest rate we've had in 50 years. And this is before the pandemic. Men die by suicide about 4 times more often than females. Females attempt more often. They use less lethal means. And suicide is now the 10th leading cause of death for all Americans. In particular, there are grave concerns about the suicide rate for adolescents, especially middle schoolers, as that rate has doubled in the last decade. There are also many concerns about suicide rates for middle-aged Caucasian men and for our military veterans. And suicide rates have nearly doubled in the last decade for Black children as well. So suicide is now the second leading cause of death for Americans between the ages of 10 and 34. Guns account for about 50% of all suicides. Yet, guns are only actually used in 5% of suicide attempts. What's that mean? You attempt with a gun, you don't get a second chance. The bulk of my career has been spent on trying to prevent adolescent suicide. And I'm reminded of the goodbye note left behind by an adolescent girl in Houston, Texas. The note to her parent said, "Why did you make this so easy? Why did you leave this gun available to me?" And I'm not questioning adults' right to own a gun today, but with that right comes a responsibility to safeguard that gun from a troubled, impulsive, depressed, mentally ill person that might reside in your very own home. And when I read of yet another suicide, I always think of it pretty simply: untreated or undertreated mental illness. And our psychology service-centered clinics provide a wide range of treatment for those with mental health issues and mental illness. Now, there's some rather sobering figures of high school students in the state of Florida in the last year. Please note, 1/3 of them said they felt sad or hopeless 2 or 3 or more weeks in a row during the last 12 months. A large percentage considered suicide. Nearly 12% made a plan. Now I can look out the window right now and I can see Nova Public High School. And I know only small numbers of students are actually physically in our schools now, but let's just round it off and say Nova Public High School has 2,000 students for simple math. I believe they have considerably more than that. What's that mean? That means 158 of them in the last 12 months made a suicide attempt? Who's the most likely to make an attempt tomorrow? That would be a kid with the previous history. You know what's really scary is I believe that for the most part, the adults in those kids' lives don't know about those suicide attempts. Their teachers don't know. Their parents don't know. The school counselor doesn't know. But who would know all about it? That would, of course, be their friends. But unfortunately, rarely has anybody ever talked to a kid about what to do to help yourself or to help a suicidal friend. It's possible we have large numbers today. Somebody actually might be thinking of suicide. And if that is the case, please call the National Crisis Helpline, 1-800-273-TALK, or simply go to the nearest emergency room. We're going to talk about the barriers. What is it that has stopped us all from really recognizing the warning signs, speaking up, and being able to just ask somebody directly, are you actually thinking you might want to kill yourself? And a lot of concern. There's some very dire predictions now about suicide rate in the age of this pandemic. And who might be the most at risk? Well, it makes sense. That would be somebody with the previous mental health condition. That would be someone who lost a loved one to this virus. And obviously, it could also be someone who is now experiencing extreme financial hardship. Maybe they're now living in poverty for the first time in their life. And there are actually lessons about pandemics in terms of suicide rates. We know the Spanish flu 100 years ago, sadly, suicide rates went up. We know when we had the outbreak of SARS, suicide rates went up. Researchers found in Hong Kong in particular. And we've had a lot of reports around the world of increased suicides during this pandemic. And the pandemic undoubtedly has affected lots of things in our families, with increased domestic violence, increased child abuse. More firearms have been purchased, increases of substance abuse and alcohol consumption. So this is a time when we should be giving to try to help promote mental health for everyone, but we should also be very aware of the warning signs of suicide, just simply what to look for and what to do. When the stock market has crashed, when we had high unemployment, suicide rates went up. Now, there was an important survey of adults done just before National Suicide Prevention Week 2 months ago. And thankfully, the majority of adults do believe that suicide can be prevented. It's not inherited, it's not destiny, but a large percentage reported barriers that have kept them from discussing suicide with others. They lack knowledge about it. They're afraid to bring it up. They're uncomfortable with the topic. They're not sure what to say. And at the simplest level, the response should be, I'm here for you. You're not the first person to feel this way. There is help available. I will be there with you every step of the way. Now, in the Suicide and Violence Prevention Office that I direct, we interview a lot of experts in the field. And one of the most prominent ones is Dr. Berman, longtime executive director of the American Association of Suicidology. He basically said, a very big problem is lack of funding. Too many Americans believe, oh, it's weakness. Oh, it's cowardly. They could just snap out of that if they wanted to. But it is a very real mental illness, and simply being overwhelmed and experiencing pain that you believe is unendurable, constricted or tunnel vision, not seeing alternatives. And I also interviewed Dr. Anestis, who really stressed perhaps the single greatest strategy to prevent suicide in this country: remove the lethal weapon from the access of the suicidal individual. There's a website at Harvard. They surveyed the research from all around the world. You remove the gun, you raise the barrier on the bridge. It's actually pretty simple. Suicide rates go down. And the vast majority of people who survive a suicide attempt, they never attempt suicide again. They say things like, it's what I wanted to do at that moment and that moment only. Now that that moment is past, I want to live. And lives have been disrupted in ways that I don't think we could have ever imagined. How extensive this pandemic is, how long it's gone on. And frankly, I think many Americans are suffering from a low-grade depression. We want this pandemic to be over, but it's not. In fact, the transmission rates are at a very high level now. And people are very concerned about going back to work. They're very concerned about a family member being sick. They're very concerned about the stress in their lives. And many Americans have financial concerns as well. Americans' lives have been severely disrupted. Now, if I was on this webinar today, I'd want somebody to say, what works? What works, according to the World Health Organization, is actually pretty simple. We've already talked about reducing access to lethal means, but in particular, they stressed the importance of getting physicians much more involved in suicide prevention. About 70% of the time, the person who died by suicide, and by the way, I'm always going to use that word died by. You tell me my father committed something, I might say you commit a crime, you commit a burglary. The term died by seems to imply they traveled a very long road. It was everything and everyone. It was everyone's fault, yet it was no one's fault. I know my father went to see his family doctor 1 week before he died by suicide. So we need physicians that inquire, that ask about mental health, that inquire about strange injuries. And we need to increase the availability of mental health services. I was on a presentation with the previous Surgeon General one time, and I couldn't believe what he said to the audience. He said, everybody says I should fix the mental health system in this country, but I say to them, we would have to create a mental health system first. The problem is, if you don't have health insurance, if you are not affluent, then it's a problem to get treatment for you or a member of your family. That's where a psychological service center comes in with its sliding scale and the tremendous amount of service it provides to the community. Now, I'd be remiss today. These are the most common warning signs. Yes, they are exhibited somewhere around 90% of the time. What do I mean by that? Somebody who just talks about death and suicide. They talk about feeling hopeless, not seeing a future, being trapped in situations, or they write about it, or they give away prized possessions. They make out a will. They have dramatic changes in their behavior. Now, I remember my father talked to me about what he wanted me to have after he was gone. I just didn't grasp what he was trying to tell me. I wished I'd have known enough to just ask directly, are you thinking about suicide? So here's a scenario for you to sort of practice. Not uncommon for one of our students, for example, to say, ever since the breakup, I haven't been able to study. I've just found out I'm losing my job. My grades are failing. I'm not sure life is worth living. What would you say to this young man? Hopefully you avoided being dismissive, or you can't give him a pep talk and say, oh, let me tell you about a time I had a lot of difficulty and how I got through it. I bet you responded with something like this, recognizing they're overwhelmed, they're in pain, they need help, and ask directly, are you thinking of suicide? I know where there's help. I can escort you over to student counseling. We can look up the employee assistance program number. We will take action, and I am here for you. So what protects against suicide? Again, according to the World Health Organization, it's all about connections. We want people to feel connected to the family, the workplace, friends, the school, and the community. And I'm working on a project with a high school in Colorado, and they actually surveyed their students recently. That isolation, that not being able to physically go to a campus and be with friends, it's taking a toll on those students. And they also said something like this, hundreds of them commented. I mean, I'm on Zoom 7 hours a day, looking at the computer screen, and then the teachers have to give me homework too. I actually think this is a time for all of us to be compassionate, lower the bar a bit for some of our expectations at school, in the workplace, and in our families. And we need coping and problem-solving skills. Our son was 8. I sat down with Jeremy and I said, son, I need to talk to you more about the death of your grandfather. He said, I mean, I'm sorry I never met the man, Dad, but you already told me he had a heart attack. Jeremy, there's a little more to the story. And I want you to hear this from me, never from someone else. 2 weeks after his heart attack, your grandfather shot himself. The word is suicide. He looked up and he said, you lied to me. No, son, I was just waiting to give you more complete information. Then he thinks a while and then he said, oh, Dad, you shouldn't feel bad. Oh, why is that? Well, your dad wasn't a psychologist like mine. He couldn't possibly have taught you all the things I know about. It's important to feel good about yourself, Dad. I mean, everybody has problems. You just need to go to an adult and get help. Now, wasn't that sweet? He was trying to alleviate my guilt. What's the most important point there? He's 8 years old. He believes he's a good person. That's what we want for every single person in America, just to believe they're a good person. They are unconditionally loved. I made numerous presentations to Parkland MSD parents, and I said something that I truly believe. When a kid lives in a stable home, when they're shown unconditional love every day, every way, they can overcome almost anything. We've already talked about the importance of mental health services. Kids need to know, we all need to know where to go and when to get help. And religious involvement, whether it's the temple, whether it's the mosque, whether it's the church, those places of worship are very powerful in terms of connections and a protective factor. I'm really proud to tell you that with my partner, a former principal, we worked really hard and concentrated on schools and suicide prevention. So we did the state plan for Texas. We did the state toolkit for Texas. We did the crisis action school toolkit on suicide for the state of Montana. We did a draft for the state of New Jersey. But with a really talented doctoral student here, Catherine Ivey, we completed the Florida steps. School toolkit for educators to prevent suicide. And what I really want to do, besides just posting that electronically, I would like to send literally thousands of hard copies to schools in Florida, because I've learned before that sometimes just telling people it's on a website they don't pay enough attention to it. You actually need to show them a few hard copies. And so that's what we're hoping to do with donations to the Suicide and Violence Prevention Office. Now, mental health professionals, schools, and communities are very challenged right now to do suicide assessment virtually. And the National Association of School Psychologists has provided guidance for personnel in schools, such as psychologists, counselors, and social workers. And the bottom line is we need a suicide prevention policy and plan. That's the place to start. We need to look at it. But when we have a student online, we need to know exactly where they are. We need to have a backup plan in case our internet connection goes down. We need to make sure that their camera is on so we can actually see them and get a little bit of a nonverbal read about how things might be going. And hopefully that student is in a confidential spot in their house when they will truly talk to us. And we need to know whether or not there's an adult in that home. We may need to call law enforcement for a wellness check. We may need to be able to reach their caregiver in that home. And there are a number of suicide prevention strategies and plans, but perhaps one that is the most essential, it's called safety planning. Occasionally, I'm still aware that some people are using no suicide contracts, which is basically asking somebody to sign here, I won't kill myself. Well, those have been sorely criticized. Why? Those are all about what not to do. A safety plan is all about what are your ideas to keep yourself safe? Something has kept you alive thus far. What is that? Internally, what can you do to calm yourself down when you're in crisis? And externally, who can you contact? Who can you go to for help? And do you know how easy it is just on a smartphone to push a button and say to Siri, I want to kill myself? Do you all know how she responds? She says simply, may I connect you with the National Crisis Helpline? So for everybody out there, because almost everybody I know in my life has a smartphone, even kids as young as like 8 years old, push the button and you are connected with the 24-hour crisis helpline. And I'm actually a very big fan of signs of suicide. It was listed on the National Registry for Effective Prevention Programs at SAMHSA, although I'm a little frustrated to tell you that the current administration did away with the registry, which basically leaves all of us scrambling to try to find what are the evidence-based programs. But one of those is signs of suicide. There's the website. I heard from them yesterday that they've had really good feedback in delivering their suicide prevention program to students virtually. Now, I'm a big believer that we need to talk to kids about how to help yourself, how to help a friend. But we need to do that in a classroom size group or even smaller, so you can get a read on how are kids experiencing this information. Hopefully they will ask you a question because they believe many of the misperceptions out there. And I need you to just take a moment. And if I had one simple thing that I hope you'll take out of today's webinar, we got to talk about suicide more. We got to make sure all of our loved ones, they know warning signs. They know. Don't keep a secret about somebody's suicidal thoughts. They know how to access the National Crisis Helpline or the National Crisis Text Line. I think I could argue right now, if we just let's look at students in America. I believe those students, many of which are still isolated at home, are experiencing greater mental health problems than ever before in their lives. I think I could argue pretty effectively that is true for every single American. Mental health needs have never been greater. Yet, I'm not aware of state and national initiatives to improve mental health funding, to get more counselors and psychologists and social workers in schools, to get more personnel involved in employee assistance programs and helping all those troubled employees, because a lot of people are balancing a lot. They're trying to monitor their kids' schoolwork. They're trying to work from home. They're trying to be a parent, a teacher, and a worker all at the same time and keep everybody healthy. And mental health professionals in particular, they need to seek out training on suicide risk assessment and management. You might think as a layperson that every psychologist, family therapist, social worker, or counselor is well trained in this issue. They might be, but they probably had to seek out either an extra course or extra training, or most of the time, to be honest, they learn it on a practicum, an internship, or on a job, because it's not a required competency to get a degree in any of those programs that I mentioned. My greatest hope is that we would prioritize suicide prevention in this country and devote significant resources. And if we were to start with students in school, see, I'd like to begin about 4th or 5th grade, because I hear from school personnel all over the world, more and more 4th and 5th graders are talking about suicide. And the question is always, do I need to take it seriously? Yes, every single time. Notify their parents, do an initial screening. I know sometimes it has to be frustrating. I wish that 9-year-old could just say, I'm mad about X. He or she shouldn't have to say, I'm going to kill myself to get our attention. But if they threaten that, we must respond. There's also a lot of research about bullying and suicide. Let me really quickly sum it up for you. There's a strong association between bullying and suicide, both for the victim of bullying and for the perpetrator of bullying. Yet, we can't rule out all the other factors that might be involved in someone's life, like untreated or undertreated mental illness and other adverse childhood issues besides being bullied. So what I hope you remember from that example, don't hesitate to ask somebody you know that's involved in bullying if they have thoughts of hopelessness, giving up, and suicide. We all need to become much more comfortable with asking someone directly. Yes, it's been 46 years. I remember the last conversation with my father. I wished I'd known enough to just ask, are you trying to tell me you don't want to live anymore? Are you thinking about suicide? And self-care plans, being honest, I never really thought they were as critically important as they are now. But in every presentation I do, I stress, we got to have a plan. We got to have a plan to take care of ourselves physically through diet and exercise. We got to get proper rest. Somehow, I doubt I'm the only person that once in a while wakes up at like 4:30 in the morning worrying about this world we all live in. Getting the proper amount of rest is critical to being able to manage stress in our lives. And simply, I'd like to ask you to think for a moment. Who are the positive people in your life? The people that are encouraging. They're behind you all the way. Please seek out those people and be that positive person for others. We need I can statements. I can manage this. I can get exercise by doing the following. I can eat healthy by doing these things. I can get proper rest. I can be helpful, kind, and compassionate towards others. This is a National Day of Giving. This is a day for us all to think about those that are less fortunate and they need our help now. So stay in a moment. Don't worry about things that haven't happened yet, and develop a self-care plan and ensure that all of your loved ones do the same. Part of that self-care plan also should be getting outside, taking a walk, riding a bike. We can maintain physical distancing. We can wear a mask, but we need to get outside. Right now, South Florida is enjoying some of the most beautiful weather we have had in months. Get out there and enjoy it. And please share with your family and your friends how much you love and care about them at this difficult time. I love this quote from Giovanni Martine. No one can do everything, but everyone can do something. And if everyone does something together, we truly can change the world. And I hope today we break any record that NSU has ever had on National Giving Day. More information is available at the Suicide and Violence Prevention Office. And there is my email. I'd love to hear from every single one of you. There are websites that provide a wealth of information about suicide prevention. There is that National Suicide Prevention Lifeline. There is the crisis text line number. And now I want to turn it back to Jen. Let's talk about more giving, and there may be some questions today.
Thank you, Dr. Poland. And absolutely, there are a few questions in our chat, and we will start reading them, or I will rather. So Dr. Poland, this question is from someone within the school district. As students remain in virtual and remote learning, even when they are physically back in the classroom, what are the best practices for discussing suicide prevention in a virtual setting?
Well, as I mentioned earlier, I'd really encourage the person who asked that question to go to the SOS website, mindwise.org, and they'll find very detailed information about how to conduct that evidence-based program in a classroom-sized group or even smaller, and just helping kids understand what to look for, what to do. Don't hesitate and don't keep a secret. So check out Signs of Suicide.
Thank you. Another question is there anything additional that could be recommended in terms of treatment for young adults or teens with ASD?
The last part of the question, students with?
Is there anything additional that could be recommended in terms of treatment for young adults or teens with ASD?
Okay, now, you know, one of the things that I have to honestly say is that I am not an expert on autism and the spectrum and disorders. You know, suicide prevention is especially challenging with that group. But every school district has specialists that have concentrated on helping children with autism. And I think that's the place to start. Start with the specialist in your particular child's school, or if you're a teacher, ask for help from the local school psychologist, because it's challenging to figure out how best to discuss suicide prevention with that particular group.
All right, our next question is from Debbie. What suicide prevention programs do you recommend for schools? Do you feel screening for suicide is appropriate online?
Okay, another great question. And that's exactly part of the SOS program. I am on their advisory board. We had a meeting literally last July about, is it safe to do screening virtually? And my thought was, given the incredible stress that young people are under, given the dramatic increases in suicide prior to the pandemic, we have to at least try it. And they've had very good results. So again, go to mindwise.org. Parent awareness is a very key part of that program with parent permission. And we need suicide prevention screening. Frankly, I think we need universal screening about mental health issues with all of our students at this very difficult time.
Great. Another question we have is, do you recommend removing suicide contracts completely, replacing with safety plan? Is this the recommended initial intake? And if so, is there a potential liability issue with that in regards to clinicians?
Okay, great. And I've actually been involved in numerous legal cases. And one of them was a college case. And the bottom line is the psychologist only discussed safety planning verbally. They had no written safety plan. That university settled that case out of court. So the safety plan and having it be written exactly prevents the lawsuit and protects that mental health practitioner from liability issues. Not to mention, what's the most important part of that safety plan? Making sure that suicidal individual has identified internal and external sources of support. And if they lose that contract, I still have my copy. Let's get it out. What do you want to add to this? And I will share that I'm sometimes frustrated. Somebody was hospitalized for being suicidal and nobody ever did a written safety plan with them. So it protects us from liability. Most importantly, it saves lives.
As a follow-up to that question, during these tough times, where do you suggest for licensed clinicians to get some additional training on suicide prevention and treatment?
Well, great question. And training is provided from all three of these entities. So, and by the way, the SPRC, Suicide Prevention Resource Center, they provide trainings on suicide risk assessment and management, as does the American Foundation for Suicide Prevention and the American Association of Suicidology. Visit those websites. You will find recommended training modules for clinicians.
Wonderful. And speaking of resources, we have a few requests. Could you please go back to the slide with the list of resources, including the crisis text line number, please?
Yes, absolutely. And by the way, it's going to be another year, but we're going to have basically a mental health crisis line. The number will be 988. It's not going to be available for about another year, but I like the concept of a 988 number is a mental health crisis. A 911 number is basically crisis of other types. But for right now, that number you see right there, 1-800-273-8255 is manned 24 hours a day by trained volunteers. And I'm proud to tell you that a number of our graduate students in the College of Psychology have volunteered, or some are currently trained and volunteering at Lifeline and the crisis text line. I'm told the crisis text line gets something like 25 million crisis texts a year, and a trained person responds.
Another question we have is, in about 2017 or 2018, there was data that indicated suicide was the leading cause of death in 14 and 15-year-olds. Is that statistic still true? What are your thoughts overall?
Well, overall, for that age group, I'm pretty certain that it is still accidents as the #1 cause of death. Suicide is #2. Now, to be honest, trying to keep up with statistics is difficult. They're always going to be 1, usually 2 years behind. And it may be true that in a particular locale, for example, I'll give you my thoughts on, I presented in Wyoming not too long ago. And by the way, no school administrators in Wyoming attended my suicide prevention talk. It was all mental health professionals, counselors, psychologists, and social workers. And then I asked, well, where are all the administrators and principals today? Well, they're back in their offices. They're catching up because they spent all day yesterday on an active shooter drill. Well, in Wyoming, suicide is the leading cause of death for an adolescent. And I have responded now personally to 16 different school shootings. But here's the bottom line. One school shooting in America is unacceptable, but schools remain the safest places children go. I only wish we could put as much emphasis on youth suicide prevention as we're putting on preventing the next targeted school shooting. Both of those are very important. So yes, in Wyoming and some Western states, suicide would be the leading cause of death for an adolescent, but not nationwide.
Our next question is someone from Michigan. As a school psychologist, can you discuss the Not Okay and My 3 apps a little more? How to use them with students, just to notify them of resources, please.
I think what really needs to happen with those apps is you need to sit down with the student. Obviously, I prefer face-to-face, students sitting next to me, we're looking at something together. But that only happens if kids are physically back in schools. Virtually, we could be visiting the websites with them. My 3 is a really wonderful way for them to keep track of mental health tips, of appointments they might have. There's another one called the Virtual Hope Box, and there's the Not Okay app. So I would suggest that you visit those apps, put them on your phone, go through them, become familiar with how they work, and then share them with students when it's appropriate. There's another app that I have on my phone, which is the SAMHSA Suicide Safe app. And I would highly recommend that everybody listening today that works in mental health put that particular app on your phone. SAMHSA Suicide Safe app. It goes over resources. It has case examples. It will increase your confidence as a mental health professional that you know what to do. You know what to say.
That goes into a lot of requests, actually, and people want to know, will your presentation and these resources that you've mentioned, can we send this out to everyone who has registered for this webinar?
Absolutely, Jen.
Great, great. I hope that answers a few of our inquiries. Another question we have is, do you have any advice on how to assist a parent who is struggling with their child's emotions and trying to get their child help, but running into barriers due to the increased need and now experiencing their own depression?
Oh, great question. And, you know, one of the things that I believe strongly is that whenever possible, we need to help adults first. So right now, we need adults that are modeling optimism, hope for the future. We need adults that are modeling self-care, and in so doing, they're setting a really great example for their child. Now, I know that often it's very difficult to figure out where to go for help. That's why I'm so grateful for our psychology service center here in the Maltz building. But we have people that are on this webinar from all over the country, but we need to figure out where the low cost available mental health services that we can refer families to. Now, this next part will probably really surprise you, but when I worked in that large Texas school district, I actually had a budget. If I had a family that didn't have resources, a family that didn't have health insurance, I can make an appointment for their child with a local mental health professional. And the school district actually paid for it as a start to getting this family in treatment. Now, how did we get to that point? We had 44 deaths of students by suicide during my 24 years that I was there. So the superintendent was in tune with the problem and wanted to do everything possible. So generally, I recommend that a key group at a school get together. Let's look at the scope of the problem. Let's look at what's working, what's not working. Let's look at who we're referring to. How can we get those families there? Who is low cost? Would the local mental health center, would they put somebody in the middle school every Wednesday at no charge? Do we have any retired counselors that would come back and work at a very low wage right now just because of the incredible mental health demands on students right now? So we got to meet, look at our community resources, our school resources, and figure out how can we get more people involved in treatment.
Thank you. Our next question is, what are your thoughts on how helpful involuntary hospitalizations really are?
Great question. Here in Florida, we have the Baker Act, and our state decided that school personnel must do a suicide screening using either the Columbia or using the SAFE-T, but they can't just call for the Baker Act team. They need to do a screening first. I think that is a very good first step. I would imagine many people listening have been a little frustrated with the process. Somebody gets involuntarily hospitalized. They leave without a written safety plan. They aren't going back to any kind of continuing treatment. Sometimes it can be a bit of a revolving door. So we need to have meetings also to look at, is involuntary hospitalization helping? Is there anything else we could be doing? The other practice, and I'm working with the school on this right now, is schools tend to say, okay, go get your kid treatment. They can't be at school again until they're in treatment and somebody says they're getting better. But that isolation, that being out of the routine, may not be a good thing. They may be largely unsupervised at home. And I think we have to look on a case-by-case basis. What can we do to provide support at school? And is it really in this student's best interest to be out of school? I also know that school personnel really all over the world have told me so much information is hidden from them, meaning the parents don't sign off. The private practicing psychologist, the hospital mental health professional is not pushing to be able to share the information with schools. Schools need to know if somebody is returning from being hospitalized for suicidal behavior. Schools need the opportunity to coordinate with the treatment professionals in the community.
Our next question is, how would you approach someone who you suspect is a victim of sexual assault and is now thinking of suicide because of it?
Well, I think we have to be direct with our questions about suicide. I find the three simplest questions have to be asked. Are you thinking of suicide now? have you ever attempted before? Tell me, how would you end your life? So I think we really have to focus on the suicidal and try to figure out what safeguards need to be put in place. And obviously, I hope that they will receive treatment for the fact that they were previously abused.
Our next question is, what types of programs or prevention efforts would you recommend for medical doctors, nurses, and hospital staff dealing with mental wellness issues due to treating patients with COVID? And by the way, Dr. Pullen, you are amazing. That's part of the question.
Well, I very much appreciate us. I know everybody listening. I mean, heroes obviously have been nurses and doctors, everybody working in hospitals. What I would really hope is the administration of every hospital would be doing everything possible to thank all the individuals working there and would make self-care plans a requirement. What are you doing to take care of yourself? Let's take some valuable staff training time, whatever we need to do to help everybody develop a self-care plan. I hope that's being done in our schools, because we have a lot of teachers that are doing extraordinary things as well in terms of trying to teach in the classroom, trying to monitor the kids that are at home. I know we have a daughter who we tried to help her set a limit. She can't be responding to parents' emails, texts, and calls until 10 o'clock at night. She has to be there for her family as well. But I hope everybody is thanking all of those individuals that are doing extraordinary things. And the National Day of Giving would be a great opportunity to be thanking everyone involved in these important professions.
Thank you, Dr. Pullen. We have just a couple of more questions. I know we are running out of time. This one is, for the LGBTQ community, could you share some information about the Trevor Project?
Well, I'm glad that somebody has mentioned the Trevor Foundation in memory of Trevor. It has a wealth of resources. And, you know, I sometimes have that on slides, but today it was a shortened presentation. So I want to say a couple of things. Yes, the LGBTQ community is more at risk for suicide, but there's nothing inherently suicidal about sexual orientation. The problem is the crap and rejection they get sometimes from the people closest to them. I know one of my good friends shared with me that when he came out 18 years ago, his dad said, "You are dead to me." How do we stop that from happening in our families? How can we get much more accepting and embracing of others? And Caitlin Ryan has a wonderful foundation also, the Family Acceptance Project. And I don't want to oversimplify, but when we have a gay kid, the single greatest protective factor for them is, does their family accept and love them for the person they are? And on this day of giving, kindness, compassion, empathy, acceptance, that's what Americans need right now.
Thank you, Dr. Pullen. And we will go ahead and ask a final question. What book or other resources would you recommend for parents of an adult child that has died by suicide recently?
You know, I got a call just this week from a colleague about a family that was very close to them that lost a loved one to suicide. What I've found in my career is that suicide survivor groups That means everybody sitting around that table lost a loved one to suicide have been very helpful. When you go to a general group and somebody lost their loved one in a car accident or to cancer, and then you say, my partner, my child, my mother died by suicide, suddenly you feel like you're not in the right place. And by the way, most suicide prevention in this country is actually driven by survivors. And if you visit the American Association of Suicidology website, you will find a wealth of resources for survivors. They put on an annual healing conference. We have a Suicide Survivor Day every fall in our country. And here locally, I'm proud to tell you that the Florida Initiative for Suicide Prevention offers free survivor loss groups. And when a parent's lost a child, there's a famous book written by Iris Bolton called My Son, My Son. And reading, realizing it was their choice, not your choice, knowing that other people are able to cope with this. We have a tendency in our society, too often we say, I understand. Could you really understand? Not unless you lost a loved one to suicide. It's also been said that losing a loved one to suicide is the most complicated grief there is. Dr. Sneidman said, it's like they left their skeleton in your closet. And what people learn to do is to keep their grief, keep in its own lane, keep it from consuming every aspect of your life. But it's very important that we always say to someone who lost a loved one to suicide, I'm so sorry. I'm here to listen. Anytime you would like to talk about this, I cannot imagine what you've gone through, but please let me know how I can help. Sometimes people say to me that even close friends say, oh, you should be over that by now. Please know, losing a loved one to suicide is a life-altering event, and you just learn to manage it. Sometimes it helps a lot to get involved in suicide prevention. And I want to thank every single one of you who stayed on today. I'm honored to have the opportunity to share my thoughts with you on this very important National Giving Day.
Dr. Pullen, we are so thankful for your time and advice on this very, very important topic, and also our viewers for tuning in. We will be sending this presentation and the recording along with suggested resources mentioned to everyone on this call. As we heal, give, and support today and every day, it's so critical, as you've mentioned, to talk about suicide prevention and mental health and to raise resources for these efforts. Our link to make a gift to Dr. Pullen's efforts and other NSU initiatives are in the chat. If our viewers are able to, please consider making a gift on this Giving Day. It's so important. And before we sign off, is there anything else you'd like to add, Dr. Pullen?
I believe together we can make a difference, and the vast majority of suicides can be prevented. Don't be afraid to ask. Don't be afraid to talk about suicide.
Thank you. And thank you everyone for tuning in.